Hello. What I'll be covering in this video is how we used our Telus Wolf EMR to look for patients who were due for screening tests. My clinic started a project 1 year ago, and we looked at 8 different types of screening tests that we wanted our EMR to automatically check for. These were cholesterol, fasting blood sugars, colon cancer, physicals, people with diabetes who were either out of control, out of target, or were due for testing, people who had had a blood pressure and mammogram screening. So every night, our EMR would look at all the data within the EMR and generate a list for people who were due for these screening tests. My staff every day would take a look at this list and select one patient, look through their neck hair as well as their chart records to make sure that we had all the appropriate information. And then based on that information, letters were sent to the patient informing them which screening tests they were due for, and appropriate requisitions were also included so that they could get those tests done without having to come into the clinic. If a patient was due for a blood pressure or a physical, then they were also asked to make an appointment via this letter. After that was done, a note was made on the chart, in the patient's chart, of this action so that we could log that we had offered them screening. Then, that same night, the EMR would delete patients who were offered screening. It would also delete patients who had results come in that same day that shows that the patient had appropriate screening. And it would add new patients for the next day who had now fallen outside the screening interval. This is an example of the letter that we sent out to patients. You can see it's a template letter, and we could just check mark the boxes that were appropriate for each patient. Their needed action, whether to be book an appointment or to have some tests done, is indicated beside. After 11 months, these are our results. You'll see that in total, to start the project, we had 11,500 action items to act on. After 11 months of this screening project, we cut that number down to 439, which is a 96% improvement. That total only indicates screening offers. When looking at actual successes and where patients had their screening completed, we improved by 54%, which is still significant. So what I'd like to show is how we achieved this using our EMR. Mostly, we used 2 methods. One was rules, and that's what I'll go over now. On the work desk, every staff and every physician can click on this rule matches line and be brought to this screen, which will show all patients that require screening. All these patients have outstanding rules, and for example, this first patient has 4 items that need to be acted on. My staff would look through neck hair to make sure there is no more recent fasting glucose, cholesterol, mammogram, or FIT test or colonoscopy that was done that perhaps we don't have in our EMR. They would create that template letter, check off the boxes that are appropriate, and include the correct requisitions for that patient. The other method that our clinic used to catch people who were due for screening was an opportunistic method. The one I had described previously was an outreach method. You'll see that up here there's the number 0, which lists all patients who are due for screening. When you change this number to a 1, now the list only shows patients who are coming in for an appointment that same day. This allows us to create letters and requisitions and hand it to the patient when they check in. It allows more direct contact with the patient and also saves money in terms of stamps. After each letter or requisition was created, as I mentioned, a message was made on the chart of that patient to log that the screening was offered. We used messages as well as macros or spell checks to make sure that each message was standardized. You'll see here that on this test patient, we have written 4 keywords, and when you press enter after each of those keywords, it becomes a defined text. This allows clear communication and saves typing time for our staff. In addition, when searching through patients that night, we can tell the computer to ignore patients who have messages such as this in their chart. In order to do that, you go to the practice search engine. You can actually tell the practice search engine, this is an example of women who do not have a mammogram in the last 2 years. We simply tell the search engine to find people who have a message that starts with screening protocol, but to exclude any people from the new screening lists who have this message within the last 12 months, meaning that if they've been offered something and it's been logged, they won't show up on our lists for 1 year. So in general, our clinic used rules every night in order to determine the lists for patients that required screening. However, this could not capture all the other information we wanted to capture, such as alcohol or smoking. So the other method our clinic used was to provide a questionnaire sheet at the beginning of every physical that covered these topics: calcium, vitamin D, do you see the dentist, do you see the optometrist, smoking history, do you want to quit smoking, alcohol use, your last tetanus booster, flu shots, pneumonia vaccines, and current method of contraception. Before the physical, they would fill this out, they would discuss it with their physician during their preventative health exam, and at the end of the day, this questionnaire would get scanned into the chart with a certain keyword so that it is also searchable, so that we could also document how many offers of screening we have been providing patients. Overall, the physicians at my clinic have found these screening methods to be very useful. The primary reason is that no physician time was used in sending letters to the patients, mining through their data or their neck care, as well as going through lengthy questions regarding their lifestyles and habits. The second benefit was that every offer that we provided to the patient is searchable through our EMR, so we can gather statistics and see how well we were doing every year.